Treatment or intervention. Youth workers, helpline volunteers, clinical workers, and individuals experiencing the symptoms all have many different ways to treat and manage depression. Pharmacotherapy, medical treatment by the use of drugs. Psychotherapy is the treatment of mental issues using psychological means rather than medical. During psychotherapy, a person with depression talks to a licensed and trained mental health care professional who helps him or her identify and work through the factors that may be causing their depression. Psychotherapy and pharmacotherapy may be used in succession as a combination of both therapies, which may be used alone. Physical activity intervention is the use of exercise as a form of depression management. However, the amount of evidence supporting this as an effective intervention is very little compared to the other interventions. Mindfulness-based therapy, or MBT, is an intervention that encourages a non-judgmental and moment-by-moment awareness. Treatment could include having someone focus on their body sensations or on the physical world around them, or accepting one's thoughts as something that can be viewed objectively. Overall, the current research on depression intervention and treatment is still full of contradictions and conflicting evidence. Among the current studies of depression interventions and treatments, it is unclear as to whether targeted interventions, for example, those that target at-risk young people, are more effective than universal interventions, so those that target the general population, or whether both are equally effective. Furthermore, it is unclear as to whether shorter interventions are more effective than longer interventions, or whether there is no difference between the two. Results of research evaluating the effectiveness of treatment. One study that examined the effectiveness of using physical activity as a treatment for depression is titled Prospective Study of Cardiorespiratory Fitness and Depressive Symptoms in Women and Men. Cardiorespiratory fitness, also known as CRF, is an objective measurement of how well the heart, the lungs, and the muscles work together to keep the body active over an extended period of time. The purpose of the study was to follow individuals over time to examine whether those with higher levels of CRF have a lower risk of developing depressive symptoms. 11,258 men and 3,085 women enrolled in the study and completed a maximal treadmill exercise test and a follow-up health survey. The prospective study was done between 1970 to 1995, with an average of about 12 years of follow-up. CRF was measured as the length of time individuals ran for. The participants were categorized into age and sex stratified groups, as the lowest 20% times being classified as the low group, the middle 40% times as the moderate group, and the high group as being the highest 40% times. Depressive symptoms were assessed using the 20-item Center for Epidemiologic Studies Depression Scale, also known as CESD. Those who scored 16 or more on the CESD were considered to have depressive symptoms. After the follow-up, 282 women and 740 men reported depressive symptoms. After adjusting for age, baseline examination year, and survey response year, the odds of reporting depressive symptoms were 31% lower for men with moderate CRF and 51% lower for men with high CRF compared to men with low CRF. When comparing to women with low CRF, the odds of reporting depressive symptoms were 40% lower for women with moderate CRF and 54% lower for women with high CRF. This study supports that physical activity has an inverse association with the risk of developing elevated depressive symptoms. The use of the maximal treadmill exercise test is a major strength in this study because it can accurately quantify the CRF of participants, rather than assessing for physical activity using a questionnaire. The large number of person years of follow-up enabled the researchers to investigate a dose-response relationship in both men and women. A major limitation in the study was that although some participants were classified as having depressive symptoms, it did not mean that they were clinically diagnosed with depression. The use of a questionnaire to assess for depressive symptoms is not as accurate as having a medical doctor diagnose the patients. The clear dose-response relationship between physical activity and depressive symptoms, as found in this study, should encourage individuals to lead a physical, healthy lifestyle. Doing so may not only reduce cardiovascular disease, but also the risk of depression. These findings are also useful to healthcare professionals as they can advise their patients with depression about the benefits of physical activity for mental health well-being.
This commercial is one of a few created by Depression Hurts in order to stop the stigma against mental health, specifically depression. This video goes on to describe and show an individual's life suffering with depression and how it affects themselves, their work life, and family relationships. I think this video is a good depiction of what depression is like and how it affects those around you. It displays a young woman not wanting to get out of bed, a gentleman who does not want to eat, a woman not wanting to play with her children, and it also shows a man not wanting to walk or play with his dog. In this short video, it has depicted a lot of the signs and symptoms of someone who is depressed. Loss of interest in activities, loss of appetite, and affecting the relationships with family. This video also tries to incorporate showing that depression not only affects us emotionally, but that it will and can affect people physically as well. I think this video does a good job of trying to put away the stigma and tries to educate people about depression and how it affects everyone. With videos like this, along with many other mental health awareness campaigns, we can maybe stop the stigma against mental health and work together in order to help those in need. Depression can affect anyone and everyone. It is important to know how to help someone dealing with depression and look for the signs and symptoms which may not always be obvious in order to be there for that person.
Where does depression hurt? Everywhere. Who does depression hurt? Everyone. How does depression hurt? You know you can feel it emotionally, but did you know that you can also feel depression physically? Go to depressionhurts.com and learn what the symptoms are. There are treatments that work on both the emotional and painful physical symptoms of depression. At depressionhurts.com, you'll find a simple checklist of symptoms. Compare it to what you're feeling. Then tell your doctor what you're feeling. Depression hurts, but you don't have to.
In conclusion, we know that depression will affect all Canadians at one point in their life. Depression will and can affect everyone at one point in their life. Although some episodes may be brief, this is a serious illness that is most common and people should not be afraid to get help. If you think you have some form of depression or know someone suffering from depression, please advise them or yourself to get professional help. People with depression also have fluctuated serotonin levels when they're going through a sad time or a rough time in their life. If the serotonin level does not return back to normal, they must seek help. There is no need in hiding or being ashamed. It can be easily treated. New treatment can be short-term with positive effects. Your community mental health professionals like psychiatrists, psychologists, social workers, and those at your community healthcare facility are ready to help you. Why should you suffer any longer when you should? There is help out there for you. Thank you.